If you have noticed that streetlights seem harsher than they used to, that headlights coming toward you feel almost blinding, or that walking from a bright room into a dim hallway takes longer than it used to for your eyes to adjust, someone has probably told you the same thing. That's just aging. And technically they are not wrong. But that answer is also dangerously incomplete, and it is the reason so many people over 60 live with vision problems that could have been caught and sometimes even treated years earlier. Maybe it started small. You stopped taking the back roads at night because the oncoming headlights felt like they were aimed straight at you. Maybe you started leaving a light on in the hallway that you never used to need. Maybe you have simply noticed that restaurants feel dimmer than they used to. Menus feel harder to read once the sun goes down, and you have quietly started asking someone else to drive after dark. None of that is dramatic. It creeps in slowly, one small adjustment at a time, which is exactly why so few people ever stop to ask what is actually causing it. Today we are going to walk through what is actually happening inside your eyes after 60, using real research, not guesses. Some of it is simply the normal, expected story of getting older, but part of it is not aging at all. Part of it is something your eyes are trying to tell you, something a comprehensive eye exam could catch, sometimes even correct. And by the end of this video, you will know exactly which is which. Before we go further, one honest note. This channel exists to help you understand real research so you can have a more informed conversation with your own eye doctor, not to replace one. Nothing in this video is medical advice. If you are noticing changes in your vision, please see an eye doctor for a proper exam, especially if you manage diabetes or another condition that affects your eyes. Let's start with the piece almost nobody explains clearly. Your pupil. In your 20s, in a dark room, your pupil could open or dilate to somewhere between 7 and 8 millimeters wide, letting in as much light as possible so you could see. This natural shrinking of the pupil with age is a well-documented phenomenon researchers call senile miosis, and it is not a disease. It is simply part of how the eye changes over time. But the size difference is enormous, and it happens specifically in dim light, which is exactly the condition where you need every bit of light you can get. By the time someone reaches 80, that same pupil in that same dark room may only open to about 3.5 to 4 millimeters. Picture a camera aperture closing down to a fraction of its original size. That is essentially what is happening behind your own eyes gradually every single year, whether you notice it or not. Here is the number that puts this in real perspective. Researchers going back decades in classic studies on aging and vision have estimated that the retina of a typical 60-year-old receives less than 1/3 the light that a 20-year-old's retina receives under the same lighting conditions. Less than 1/3. That is not a minor dimming. That is the equivalent of someone quietly turning down the lights in every room you walk into, every single day for 40 years, without you ever touching a switch. This single fact explains so much of what people over 60 describe feeling. It is not that the world got darker. It is that less of that same light is reaching the back of your eye. And once you understand that, a lot of the frustration around night driving, dim restaurants, and unlit hallways stops feeling like a personal failing and starts feeling like exactly what it is, a measurable, well-documented physical change. But the pupil is only the first part of the story. There is a second change happening at the same time, and this one affects the quality of the light that does get through, not just the quantity. The lens inside your eye, the clear structure that helps focus light onto your retina, changes texture as you age. It gradually becomes denser, less flexible, and less transparent. Instead of letting light pass through cleanly, the way a clean window lets sunlight through, an aging lens starts to scatter some of that light, the way a foggy window does. This is precisely why headlights and streetlights can start to feel almost aggressive at night, even when your daytime vision still feels perfectly fine. The light is not actually brighter. It is being scattered inside your own eye, spreading out into a kind of glare and haze instead of landing where it should, in a sharp, focused point on your retina. Researchers describe this as one of the earliest and most common signs of a developing cataract, and it often shows up in night vision long before it becomes obvious in daytime activities. Some studies measuring visual acuity in people with early cataracts have found a meaningful loss, in the range of 13 to 20%, specifically under low light and glare conditions, even in eyes that still test as reasonably sharp in a bright, well-lit exam room. That gap between how your eyes perform in a bright office and how they perform on a dark road is exactly the kind of thing a standard daytime check can miss entirely. Before we go further, this is exactly the kind of research we dig into every week on this channel, so if this is useful, take a moment to subscribe so you don't miss what's coming. If something in this video connects with what you've been noticing in your own eyes, tell us in the comments. We do read them. And if you know someone else past 60 who has quietly stopped driving at night, or who keeps saying their eyes are just getting old, send this to them. It might be exactly the information they need before their next appointment. Now here is where the story gets more layered, and where the title of this video really comes into focus. Because there is a third change happening deeper inside the eye, in the retina itself, and this one is less visible, less talked about, and in some ways more important than the first two. Your retina is lined with light-sensing cells. The ones responsible for vision in low light are called rods, and researchers have found that both the number of these rod cells and their overall sensitivity decline gradually with age. On top of that, there is a well-documented slowing in something called dark adaptation, which is simply the process your eyes go through when you walk from a bright space into a dim one, and your eyes have to catch up. If you have ever walked into a dark movie theater or gone outside on a clear night and felt like it took much longer than it used to for your eyes to adjust and start picking out shapes in the dark, that feeling is not in your head. Studies measuring dark adaptation in older adults, compared to adults in their 20s, have found a genuinely dramatic slowing in how quickly the visual pigment inside rod cells, called rhodopsin, regenerates after exposure to bright light. That pigment is what allows your eyes to function in low light in the first place, and its slower regeneration is a big part of why nighttime adjustment takes longer as we age. What makes this particular change tricky is that it rarely announces itself directly. Nobody tells you, in a normal day, that their rhodopsin is regenerating more slowly. What they notice instead is something far more ordinary sounding, that stepping out of a bright grocery store into a dark parking lot at dusk feels momentarily disorienting in a way it never used to, or that finding your seat in a dim restaurant takes a few extra beats longer than it once did. Those small, easy-to-dismiss moments are, quite literally, the visible edge of a measurable biological change happening deep inside your retina. There is also a lesser-known side effect of the shrinking pupil worth mentioning because it connects to something else entirely. Your body's internal clock relies partly on light, specifically a certain wavelength of blue light, reaching your retina to help regulate your sleep and wake cycle. Because an aging pupil lets in less of that light overall, some researchers have proposed that this could be part of why sleep patterns often shift with age, though this remains an active area of study rather than a settled conclusion. It is a reminder that your eyes are connected to more of your daily life than just what you can see, touching everything from how alert you feel in the morning to how easily you fall asleep at night. And here is something worth knowing if you are worried about headlight glare specifically, because the actual data is more reassuring than the conversation around it. A large study analyzing real crash data across 11 states, published in late 2025, found that nighttime glare-related crashes have stayed relatively flat over the years, even as headlights have gotten brighter, and that drivers over 70 specifically appeared to be the group most affected by glare, more so than drivers in their 50s or 60s. That is useful, specific information, the kind that can help you and your doctor figure out whether your own glare sensitivity is within a fairly common range or worth a closer look. But here is the detail almost nobody talks about, the one that gives this video its title. All 4 of those changes we just covered are considered a normal, expected part of getting older. They happen to nearly everyone to some degree, whether their eyes are otherwise perfectly healthy or not. But researchers and eye doctors are consistently clear about something important. Night vision decline is not always just that. Sometimes it is being caused, or made significantly worse, by a specific, identifiable condition, one that a comprehensive eye exam can actually detect. Cataracts, the clouding of the lens we already mentioned, are one of the most common of these conditions, and they exist on a spectrum. According to data from the National Eye Institute, by the time Americans reach 80, more than half have developed a cataract or already had cataract surgery. Early cataracts often show up first as difficulty at night, glare around headlights, halos around streetlights, before they meaningfully affect vision during the day. Depending on how advanced they are, cataracts can be monitored or, in many cases, treated surgically, restoring a meaningful amount of clarity that many people assume is simply gone for good. There is also a quieter cause worth mentioning, one that has nothing to do with the eye itself. Certain common medications, including some used for high blood pressure, allergies, anxiety, and sleep, can affect pupil size or the eye's ability to adjust to darkness as a side effect. If your night vision changed noticeably around the same time you started a new prescription, that timing itself is worth mentioning to your doctor or pharmacist, who can check whether your specific medication is a known contributor and whether an adjustment makes sense for you. And then there is one more piece worth mentioning honestly. Vitamin A is essential for the production of rhodopsin, the very pigment we talked about a few minutes ago, the one responsible for helping your rod cells function in low light. A genuine vitamin A deficiency can cause real night blindness, but researchers are also clear that outright deficiency is the exception, not the rule, in people who eat a varied diet, and self-prescribing high-dose supplements without a blood test first is not something we would ever recommend. If this is a concern for you, the right first step is asking your doctor for a simple blood test, not guessing. Glaucoma is another condition frequently mistaken for ordinary aging. It involves gradual damage to the optic nerve, often tied to pressure inside the eye, and research shows the risk roughly doubles between age 65 and 80, eventually affecting close to 1 in 10 people in the oldest age groups. Nationally, more than 2 million Americans have been diagnosed with glaucoma, and researchers estimate that roughly another 2 million have it without yet knowing. What makes it especially easy to miss is that it often develops without pain and without an obvious symptom at first, quietly reducing peripheral vision and increasing sensitivity to glare, long before someone notices anything wrong during a normal day. Regular eye pressure checks are the primary way it gets caught early, while there is still the most to protect. Age-related macular degeneration affects the macula, the part of the retina responsible for sharp central vision, the vision you use to read a menu, recognize a face, or watch the road ahead of you. More than 1.5 million Americans over 60 already live with an advanced form of it, and among white Americans over 80 specifically, more than 1 in 10 has some vision loss because of it. It can quietly reduce contrast sensitivity, making it harder to distinguish a shadow from a curb or a dark car from a dark road, especially at night. Picture for a moment 2 different people, both 68 years old, both noticing the exact same thing, more difficulty seeing at night than they had 5 years earlier. The first person shrugs it off as just getting older, adjusts quietly by avoiding night driving, and never mentions it at their yearly checkup because it does not feel like a real medical issue. Over time, they simply stop offering to pick grandchildren up after dark, stop going to the evening events they used to enjoy, and slowly narrow their own world without ever quite deciding to. The second person mentions it specifically to their eye doctor, gets a comprehensive exam with dilation, and finds out they have an early cataract, one still small enough to simply monitor for now, along with a prescription update that meaningfully reduces the glare they had been fighting for years. Both of these people are living the exact same age-related changes we described earlier, the pupil, the lens, the rods. But only one of them found out whether something more specific was also happening. That is the entire difference this video is trying to make. There are also a few practical, low-cost adjustments worth knowing about, separate from any medical treatment, simply because they work with the eye changes we have described rather than against them. Anti-reflective coatings on glasses can meaningfully reduce the scatter and glare caused by an aging lens. Brighter, more even lighting at home, especially in hallways, staircases, and bathrooms, gives an aging pupil more raw light to work with and reduces the sharp, bright-to-dark contrast that makes adaptation harder. Keeping your windshield and headlights clean and having your glasses prescription checked yearly rather than every few years can also make a bigger difference at night than most people expect. And giving your eyes a few extra seconds when moving from a bright space into a dim one rather than rushing respects the slower dark adaptation we talked about earlier, instead of fighting it. None of these replace an eye exam, but they can make daily life noticeably easier while you figure out what else, if anything, is going on. Here is why all of this matters far beyond comfort or convenience. Researchers studying driving safety have consistently found that drivers over 65 face a genuinely higher risk of fatal nighttime crashes, somewhere between 2 and 4 times greater than their own risk during the day, and second only to drivers under 25 in fatal nighttime crash rate per mile driven. Glare from oncoming headlights, slower recovery after that glare, and reduced ability to make out road signs at night all play a documented role in that increased risk. And here is a number that might resonate with you personally. Research has found that roughly 1 in 3 older drivers has already, quietly on their own, reduced or completely stopped driving at night because of exactly the concerns we have been describing in this video. If that is you, you are not alone and you are not imagining the difficulty. But that adjustment, on its own, without ever finding out why it is happening, means potentially missing a treatable cause, hiding behind what feels like ordinary aging. This is exactly why professional guidelines, including those from major ophthalmology organizations, generally recommend a comprehensive dilated eye exam every 1 to 2 years for adults over 65, and annually for anyone managing diabetes, regardless of whether their vision feels like it has changed. Waiting for a problem to become obvious during the day means many of these conditions have already had years to develop, quietly, at night, first. This is the real shift we want you to take from today. It's just aging is true, but it is not the whole truth. And treating it as the whole truth can mean missing cataracts that could be addressed, glaucoma that could be caught early, or diabetic changes that need closer monitoring. The honest, useful answer is not to panic about your night vision. It is to stop assuming and start asking, with an actual comprehensive eye exam, ideally one that includes dilation, so your eye doctor can look directly at what's happening inside. You have navigated the dark before, quite literally, for decades of early mornings, late drives home, and rooms with the lights turned low. Struggling with it now is not a sign of weakness, and it is certainly not something to feel embarrassed about in front of family or friends. It is simply your eyes doing exactly what eyes do over time, sometimes with an added twist that deserves a proper look, not a shrug.